Helix is a population genomics company whose mission is to empower every person to improve their life through DNA. Through our end-to-end solution, we're enabling health systems to bring the power of genomics to their communities while creating one of the largest genomic phenotypic databases.
Helix is taking an end-to-end approach to what we call population health or population genomics. What that means is that we work with health systems, with providers, to integrate the genome into the way that they deliver care to their communities. This involves a research aspect, a clinical aspect, and importantly, a give back of results to the participants, because we believe that each person deserves to actually have the results from their own genome.
DNA is collected from anyone who wishes to participate in one of these health initiatives. And by being a patient within a health system, or even being in the geographic region of a particular health system, we can bring people in to provide a simple DNA sample. They spit in a tube, we can sequence that DNA, and then we can provide them with a lifetime of insights.
To do population genomics at scale, we really believe you need a world-class participant experience. That includes both non-clinical and clinical return of results. So what we've built is every individual person can log into their Helix account, where their genome is stored on their behalf throughout their lifetime. In their Helix account will be non-clinical insights such as ancestry and traits, things that we know are just for fun, but millions of people are interested in exploring. We've also built a clinical return of results experience, which is incredibly important to help this scale. Because when you're sequencing every person on the way into a health system, you need something that's scalable. That is the portal that our participants use in various states around the nation now to understand their genomes and to come in for the first time into this world.
There are so many ways that people can positively benefit from understanding their genetic risks. That can be early intervention, it can be screening, it can be making appropriate lifestyle changes, or early diagnosis so that you can make sure that the impact of any disease has effective strategies to deal with it at that point in time.
Helix's business model is actually very simple. We work with health systems and researchers primarily to integrate genomics into what they do. Our business model is really a lifetime value longitudinal use model. You can think of it almost like value-based genetics. Up front, we do operate one of the largest CLIA-CAP laboratories in the world. We run a proprietary assay called Exome Plus that is a panel-grade exome, so it can be used to deliver clinically actionable results, but also has a lot of data to be used for research and for use in the future.
The Exome Plus is a custom assay we designed here at Helix to encompass the wide range of applications that are useful in medicine as well as in research. We designed it specifically to cover the medical portions of the genome at very high depth and completeness, as well as cover non-coding regions throughout the genome that allows us to encompass all the research applications we could think of. One of our highest priority projects is something called the Healthy Nevada Project, which is run in partnership with Renown Health. And what we're doing there is creating the intellectual and research foundation for broad-scale population-level sequencing, which we believe will enable everyone to be healthier and happier over their lifetimes.
Through the Healthy Nevada project, we learned of a patient that had a high risk of FH, something that the patient didn't know about. In fact, that patient had a very healthy lifestyle. It's very exciting to be able to provide that type of information to somebody. They're able to take action and essentially massively reduce the risk. We're only just starting. This is one patient, but we're really excited about the impact we can have.
What we've created is one of the largest data sets of clinical exomes paired with electronic medical records that isn't a closed proprietary data set owned by a pharma company. So when we do research with our health system partners, we intend to publish. We already have started doing that, including some of the work that showed the impact of this in the community, as well as look for novel discovery so that the genome can be more and more valuable to everyone in the future.
We love what we do because we have an ability to have an impact in a new space. Working with healthy people and making sure they have the best information available to them at a population level is something that's really exciting. And so coming to work every day and having a chance to have that kind of impact is really fun.
As a genetic counselor, I am incredibly excited about where we are today. We have come so far over the last decades to be able to give people the power of genomic insights to really impact their lives. This is something we couldn't do before, and today it's a reality, and we are creating ways to responsibly deliver this information to everyone.
We think there will be many ways that people are able to access their genome and will engage with their genomic data during their lifetime, whether it be for health purposes or for recreational purposes. We think people are going to be routinely accessing their genome in a very convenient digital way, and that would be enabled by Helix.